Well, Edd Terrey is the Managing Director of Community Integrated Care, a charity providing social care services across the East Midlands and beyond, and joins us now. Hello, Ed. How are you?
Good afternoon. I'm well. How are you?
Yeah, very well, thank you. Thank you for being here. So strong words from the Prime Minister then. The NHS will collapse unless this problem is fixed. From your perspective, how closely linked are these two things?
So first of all, thanks very much for having me. Listen, the Prime Minister is absolutely right to recognise that you cannot fix the NHS without fixing social care. And here at Community Integrated Care, we welcome the fact that social care is finally being treated as a national priority. Look, there's been years of promises and missed opportunities for reform. Now, the NHS and social care are deeply connected. When one struggles, the other one feels it too. But for us, it's really important that your listeners, understand from our point of view that social care is much more than just solely supporting NHS. At Community Integrated Care, our mission is about helping people live their best lives possible, and social care enables people to live independently, build relationships, contribute to their communities, and really achieve their ambitions. So, look, there's a really fantastic opportunity here. A stronger NHS is one of the benefits, but first and foremost, it's also about helping people who draw on social care to live the lives that they really want to lead.
So a lot of people hear this phrase social care, but for people that don't come into contact with it very often, can you just explain what the community integrated care does and the difference that these types of services can make to people's everyday lives?
Of course. So Community Integrated Care, we're one of the UK's largest health and social care charities. We support over 2,700 people with a range of support needs across England and Scotland, but across the East Midlands we have 30 services, and we support more than 140 people with learning disabilities across Leicester, Derbyshire, and I have the pleasure of visiting those services on a regular basis. But for the people we support, a social care system under pressure can mean things like longer waits for the right support, less choice, greater uncertainty for families. And it can really make it harder for the people who draw on social care to live independently. There's real issues then with staying connected to communities and accessing opportunities that many of us just take for granted. As I said, here in the East Midlands. Oh, sorry.
Yeah. So I was going to say, so what makes your life difficult? What if you had to, rip up the rule book now and start again? What would you like to see change?
I think, despite the pressures facing the sector that everyone knows, we've got fantastic colleagues delivering amazing services every single day. Lots and lots of people delivering amazing services here in the East Midlands. So for us, one of the things we've been campaigning about for a long time is the disparity in pay between adult social care providers and their colleagues in the NHS. Mm-hmm. We've launched our Unfair Care campaign for the last 5 years, and we've been highlighting that gap between those really skilled the workforce we have in adult social care and the pay and recognition that they receive. So for us, one of the biggest things we'd like to see change is, if we're serious about reform, that has to be addressed. Things like our sector has really high vacancy rates, really high turnover. It's a real challenge. At Community Integrated Care and across the East Midlands, we're fortunate that we don't suffer so much with those things, but that's because we've invested heavily in pay and training. But for us, it's providers shouldn't have to work within a broken funding model to achieve those things. We believe that with the right investment across the sector, more people could access stable, high quality support they deserve. So for us, it's really addressing that disparity between pay rates between adult social care and colleagues with comparable skills and responsibilities in the NHS.
Which I understand completely. And look, of course people want fair pay. They want to be recognised for the work they're doing and paid fairly for that. But we're already hearing about extortionate bills for social care. I mean, I've heard people talking today about, £1,500 a week as a ballpark, up to £2,000 a week. Surely, if wages go up, then this figure is just going to spiral. Surely it has to.
And I think some of the figures there are very much around older people's care, which is a really important and really huge part of the adult social care issues, and some of the big issues with some of that pay. I think for providers like ours, we provide adults with learning disabilities and autistic people to live the life they choose up and down the country. So some of those pay rates and their costs are significant and they spiral, but the cost of not doing something, not doing it are also doesn't really bear thinking about. We've got a potentially crumbling workforce with more and more people drawing down on support needs as people live older. So this reform is very much needed, but we need meaningful action now. We've heard some really, really important first words, and it's really pleasing that so early on in our new Prime Minister's tenure that social care is right at the top of the agenda, and we look forward to working with the government to really understand the detail that sits behind some of these really important policy steps over the next few weeks.
Yeah, and we often hear about patients who are medically fit to leave hospital, but then can't because the right care isn't in place. And I've heard several stories about this today. So how common is this? And then what impact does it have for both the NHS and then other surrounding services as well? And how can we sort of mend that relationship between the two?
Yeah, it's huge, and really pleasing when the Prime Minister mentioned today around how we can support people from entering the NHS and that part of that system beforehand. Now, great social care we know can make a huge difference to the pressure that the NHS face. It really can help people leave hospital sooner, but importantly, help prevent avoidable admissions in the first place and ensures that people get the right support, the right setting. We, at Community Integrated Care, we see this particularly in specialist services. So people with learning disabilities and autistic people living in long stay, really inappropriate hospital settings, which are extremely expensive, really not great. And we know that with the right support, those people could be living with their families in their communities, which it takes a lot of time and effort and support, but it also, from a cost perspective, if we get that right, it's actually a hell of a lot cheaper than what we currently spend on those inappropriate hospital settings that a lot of people are in.
Okay, Ed, thank you very much. We'll leave it there. That is Edd Terrey, the Managing Director of Community Integrated Care.